I completely understand and agree with you on this, because patients would have a lot of questions. They may be very anxious and they're looking for answers. So I completely agree. A lot of time they would interrupt us. But at the same time, I always say we are trained doctors. They are not trained patients. So we will come across patients who would interrupt. We would come across patients who would even act aggressive or may not know how to behave. Proactively, if I know how to handle that patient, I will be able to calm that patient down. Maybe if the patient asks me questions right in the beginning, even before I started talking, I'll have to assert and say, allow me to first understand your problem, and then I'll give you time to answer your questions. But I completely agree with you. There are patients who would just be, asking you questions and disturbing you in between. I don't deny that fact. Okay. So as I said that we will be discussing about the, one second. Dr. Kaur, I think she's getting disconnected very often. I don't know why it is, but then I can see often on she's getting disconnected. Yeah. So as I said, we need to discuss about two things. One is active listening and the feedback part. So as we did this activity on the metro ride, I think we got an idea that we have a tendency to rush through what people are saying. So any idea how many types of listeners are there? Any idea?
Active and passive, too.
Okay, passive listeners who would just be listening quietly every. Then there are active listeners who would participate.
Yeah, they'll be active listeners.
They'll be actively listening. So there's another way of classifying, and that will interest you. For example, there will be kind of listeners who will pretend who are listening. A lot of time you will see a blank look in the person who would be attending to you or who will be talking to you, and you can immediately make out that this person is not listening. So you will see that they are just pretending to be listening. There are some who would just outrightly do not hesitate displaying their disinterest. So they will completely kind of say, I don't care to listen to you. A lot of time when we go to government offices, banks, or places like this, people would just not acknowledge our presence. They will not even acknowledge that we are there in their visual field. And even when we start talking, they would not listen to us, or they would not try to, pay any attention. There are those who are in hurry to answer. I think a lot of us are the kind where we get into the answering mode sooner than later, and we start, replying rather than understanding what the other person is trying to say or ask. There are very few who actually listen. So if I may tell you the levels of listening, I think ignoring and pretending and selective listening. Sometimes a lot of us do selective listening. For example, if a patient has come to an ENT specialist or an eye specialist, or say, for example, a person to a physician, and if patient has some gynae problem, we would not listen to those complaints, and we'll just straight away say, go and talk to the gynecologist. Or for example, they start talking about some emotional issues, maybe mood fluctuations or inability to sleep, loss of appetite, loss of interest in life, or too much of aggression. Normally we would not pay much attention to it and will focus only on the disease that we are treating. That's more like selective listening. But I think in healthcare, what we require is attentive listening, where we are listening to the person, interactive listening, where we are in active interaction with the patient. When patient speaks, we listen. When we speak, patient listens. And then highest level of listening is empathic listening, where you are not only listening, just because we are in healthcare, so patient are going to come to us with suffering, with pain, with their concerns. So I need to not only listen attentively, but also I need to see the patient in totality and see the body language and the emotions and understand what are the concerns, underlying concerns. And then from a therapist point of view, I would think, okay, how can I help this patient? What best strategy will help this patient to deal with this situation? So empathic listening is more to do with understanding what is not even being said by the patient. And I think that is the highest level of listening that's really required. So when we are interacting with the patient, it is not only that we have to listen attentively, but we have to demonstrate also that we are listening. Because a lot of time you are listening and simultaneously you are noting down what the patient is saying. Do you think the patient is able to see your intention? A lot of time not. So they come out with the thinking, the doctor was not even making eye contact with me. He was not even nodding. He was not even paying attention. I don't know if he really heard my problem or not. So not only listening, but demonstrating how do you listen attentively. So what are the different ways we can demonstrate that we are listening attentively? If you could write in the chat box. What are the different ways? Okay, eye contact, absolutely. Nodding, yes. Leaning forward, absolutely. Keep questioning, yes. When you ask questions, they get an idea that you're listening and you're trying to get deeper understanding. Eye contact, nodding, saying I understand, absolutely. Reconfirming, yes, absolutely. So we have an idea that these are the ways that we need to actually demonstrate, communicate that we are listening. So a lot of it we have already covered. So when you're talking to a person, when you're interacting to a person, face the person. A lot of time we have computer or the laptop in front of us and we are directly adding information in the computer. So our eye contact is not maintained as much as it is required, and also at times we are not facing the person. So it's like having a third person in the room. So it's always a good idea to face the person, make adequate eye contact, even if you are adding information on your laptop or iPad. Smile if appropriate. Last time also we discussed about the importance of smile. A lot of us consider smiling will make patient my friend. It creates comfort and a welcoming expression to the patient. While talking to the patient, or rather, if you're doing an important talking, do not do multitasking. Put your things on hold for a moment and listen to the person. Lean forward. Many of you have already mentioned it. Nod to communicate. I'm listening, I'm understanding, I am agreeing. Avoid interrupting. When the person is saying something, it's better to let that person complete, because mind can do only one thing at a time. If I have something to say, and if you interrupt me, what you say, I will probably not be able to remember or understand. So allow the person to speak. And then if you, in case if you need to interrupt, then you say, just a second, I wish to know more about it. And then you take the patient to the other question or to the other point. But when the person is still speaking, if you interrupt, that's not going to help. Ask questions, like many of you have said, ask questions to clarify if you don't understand anything. Yeah, so that means we really need to practice these skills to demonstrate that I am listening to you. Especially with patients, when you are listening, there's a possibility that we start judging the person from the appearance, from the way the person is talking, the clothes that the person is wearing, the way he's dressed up, the way he's standing or sitting. So we really need to hold judgment, have patience to allow the person to complete. Be mindful of the body language, because a lot of time we do not say anything, but our body language says that I'm not interested in listening to you. Restate whatever patient has said so that you can communicate, yes, this is what I understand. Am I right? And then ask questions. So these are all the ingredients of active listening. Now, these are a couple of activities we all do, and you can see the answers on the right side. Suppose if I get distracted, if it is always, usually, often, rarely, never. So you have to give points, and you can write your scores in your notebook and do a total for all of this. So for example, when I listen to others, I get distracted. If it is always, you have to give yourself 0.1. Usually 2 points, often will get 3 points, rarely will get 4 points, never will get 5 points. So same way, go ahead and do all 8 of them. 7 of them, sorry. And once you have done the total, write your scores in the chat box after you have done this total. Dr. Puneet says 20. Dr. Venkatesh 32. Okay. Dr. Deepa Singh 25. Mr. Mohan 27. Very good. 30. Mr. Vijay Kumar 24. 24. Okay. Dr. Praveen Manga 24. Dr. Azad 24. Okay. Mehdi 23. Dr. Rajesh Talwar 24. So you have a fair idea about the kind of errors we do in communication. 23, Dr. Chatwal, and then Mr. Manchimohan, 25. So lower the score, higher the scope for improvement. But if you're already close to 30, 35, you are on the right track. But this is when you are doing it with every patient. At times we become liberal in scoring ourselves. If you think you have considered yourself over a large number of patients, and if you think that's the way you behave, wonderful if it is. Because if you don't get distracted, if you listen to the facts, if you don't interrupt, if you do not assume that the other person, what other person is saying. So all these are ways to help you. You know, they are the distractions, or they are the learning, you know, interferences that happen with us. So if you are able to keep all these in check, I think that's a wonderful way. So this, just one second. Okay, I'm giving you another question here to give you an idea, the kind of, you know, actions we do realize, either we are aware or not. For example, these are the listening bad habits, you can say, that we normally, you know, commit in our communication. So see how many tick marks you get on this. So don't be liberal in giving yourself scores. And write your scores in the, okay, Dr. Chachwal has already mentioned 7. Okay. 4. Dr. Monga is, again, Dr. Deepak Singla says 4. Okay. 2. Okay. 5. So again, you can see, higher the score, more we are in habit of, you know, practicing wrong habits in our communication. And the answer is right within the questions. I think these are the things we need to work if we want to become effective listeners, because listening is, although the thumb rule is 80% listening and 20% talking, even if I don't go by that proportion, 50% of the communication is listening. And we really need to listen with intention to understand. So this gives you an idea what we really need to work on. You can even take a screenshot of this so that you know what I need to work on. You can take a screenshot of this, although I'll be giving you video, so you will have the questionnaire with you, but this will give you a fair idea. And if you want to see the previous questionnaire also, I can take that. Sorry. Even this one, if you want, you can take a screenshot. So I can see a lot of answers. 2, 7, 6. Again, I think this should give us an idea where we stand and what is the way out. Okay, so as I said, communication has two important parts. One is active listening and second is feedback. See, the whole purpose of communication is when both the parties are on the same page and they hold a shared meaning. What you said, if that has been exactly understood by the other person, then you can say, I have actually been able to communicate effectively or in the real sense. But what exactly happens? Do really people understand what we say? So let's do another activity to understand, do really people understand what we are saying? I'm going to give you a set of instructions and you're going to draw a bug. Let me stop sharing. We are going to draw a bug according to the instructions that I'm going to give you. So this bug is round. So you can draw as per whatever your understanding is. The bug is round. The bug has 8 legs in pairs, 4 legs on the left and 4 on the right. In the pair, 1 leg is longer than the other. The bug has feeler on the front of longer leg. The bug has a pea-pod shaped wings, not a. The bug has pea-pod shaped wings. The bug has a stinger coming from the bottom of its body. Should I repeat this one? The bug has a stinger coming from the bottom of its body. The bug has 2 eyes placed on both sides of the face. The bug has a round mouth placed between the 2 eyes. The bug has laid 5 square eggs on the right side of the stinger. If I may request everyone to bring your drawing closer to the camera and show. I hope the drawings are identical. Is it identical? Is it same? It's so different. Why? Why do you think our drawings are not same? Why do you think our drawings are not same, although I gave same set of instructions?
Our understanding is different.
Yes, exactly. So when you tell your patient, sorry,
our perceptions are different.
Absolutely, perceptions are different, interpretations are different. Meaning that you get from that same sentence is very different. So when an ENT surgeon says to his patient who has comfort tympanic membrane, repair, that this surgery has 90% success rate, what do you think the patient will understand from that statement? What are the different meanings that he may get?
He will feel that all his problems will be over, at least in 90% of the cases.
Okay. Okay.
He may feel he will belong to that other 10%.
Absolutely. Somebody might think that, oh, I may be out of those 10% who will not have a good surgery, or 90% of chances that he will be better. Yes, he might even think in that manner. What else? That I will get back maybe 90% of my hearing. Or 90% is a very high chance. That means it's a good probability. Whereas we all know the risk involved. Then he may also think, okay, 90% of the whole will be covered, maybe 10% will still be left. So the idea is, when you say something, the patient might understand from the understanding patient has. And a lot of time there is communication gap just because what you said to your patient is not exactly understood by the patient. Yes, the Dr. Monga says that he may think that there's a high probability of getting better. Absolutely. So again, it depends. What is his understanding of 90%? What is his interpretation of 90%? But some people want 100% result. And then there's always a risk. So what is the way to make sure that the person has exactly understood what you want to say?
Something like a read back, or have you understood what I have said? Like a closed loop thing. Absolutely.
But how many of us really ask the patient or the person to repeat it? Next time when you write discharge slip for your patient and ask your patient, have you understood what I've explained to you? The patient will say, yes, samajh aa gaya. Ask him to repeat in his words. Trust me, you will get to see a lot of miscommunication, either about the dosage or about the follow-up or anything else. So a lot of time there is, communication failure just because the person has not understood. And I think this activity that we did on the draw debug, I gave same set of instructions to everyone, but everybody's interpretation was very different. So as a result, everybody got a different drawing done. So one of the best ways to check or to make sure that the person has understood is called teach back technique. So teach back technique is, okay, I've explained you everything about your treatment or outcome, or especially when you are giving, prognosticating, or you're talking about something that doesn't have a very good, prognosis. So you may think I've already explained to you that there's a very less possibility of getting your vision back, or very less possibility of getting your hearing back. But then when you ask the patient to speak, you will get to know that they have actually selectively heard what you said. Doctor साहब आपने कहा सब हो जाएगा, मुझे लग रहा है आपके बात से मुझे समझ आ रहा है हो जाएगा. Tomorrow the same patient can come back and put you in trouble. So teach back is a technique where you very politely say, okay, I've explained to you everything. I'm sure once you go home, your family would like to know about what we have discussed. Can you tell me in your words, what have you understood? And that will give you an idea how much has really the person understood. And that gives you a scope and an opportunity to correct misinformation. So teach back is a wonderful technique to, first of all, make sure that the person has understood. And in case if there's a communication gap, you can further, give information and correct this miscommunication. So I think feedback is a very important thing that we have to really follow in healthcare, because a lot of errors happen because of miscommunication when the person has not understood. A lot of time you will give a set of instructions to your nurses or your technicians. They may not understand about the dose or the timing or something related to patient care, and there can be error because of this. So besides this, I think two deciding factors that decide the quality of your communication are, one is your attitude. I think right in the beginning I said your attitude plays a very big role in how you handle your profession, handle your duty, handle your work. And incidentally, your attitude gets shown, if you like or not, it is visible on your face. So anger, irritability, unhappiness, frustration that is visible and that shows your attitude towards your work. So it's very important to see what is my attitude towards my work. Second point that I would always emphasize, and that is empathy. So if I may ask you, what do we understand by the term empathy? We have talked about it a little bit, but I just want to understand what exactly we mean by empathy.
Putting yourself into others' shoes.
Absolutely. If you are able to put yourself in the other person's place. So for example, we all have gone through COVID-19. A lot of us have actually personally seen our family members, becoming sick and serious and needing hospitalization and medical aid. Now, if somebody talks about something like serious condition, we get an idea. Those of us who ourselves have been patients for this reason or for any other reason, or have had a chance where we were attending to a patient or our family member was sick and we were visiting hospital, I think we would know the plight of the patient. So empathy is one thing I think that makes you understand the other person's perspective. I am very surprised to share this with you, and very feel sorry to share this with you. One of the programs where I was, interacting with the postgraduate students. So one of the medical students asked me, why are we expected to have high empathy? Honestly, if you ask me, for a few seconds, I didn't know how to answer it, because that's probably one of the virtues each one of us who is working in healthcare needs to have. Because patients, when they come with suffering, they expect us to understand their suffering and then proactively help them. If we start practicing empathy, I think we are able to see their world through their eyes. We will not judge them for their wrong behavior. We will understand their behavior and their feelings from their point of view, and we will communicate to see how we can reduce their suffering. If I may ask you, what are the barriers in expressing empathy? Do we see a lot of empathy?
No. No.
For some, yes. For some, no, I would say. I agree. I think I agree with both the parties. Yeah. But what are the reasons? What are the barriers? Why don't we express empathy? What is the hesitation?
Partly it is arrogance.
Okay, that could be one. I agree. Arrogance is one. Second, somebody said ego. Yes. Again.
I know everything. Attitude.
Attitude. Okay. Hurry. And
They
less
would,
time.
they would have had a bad experience earlier, and then they don't want to show the same thing.
Okay. Okay.
Our preoccupation with any of our own incidents occurred.
Okay, so I think I would like to talk about 2-3 things here. One is hurry and less time. See, empathy does not require any time. It's an attitude that gets displayed in our way of functioning. I agree, if we have had some bitter experience in past with somebody, so we kind of lose, empathy and compassion for people because we have been ill-treated by others. I completely understand. But at the same time, the patient who has come to me for treatment has come with a set of expectation. And it is just a matter of attitude and not of time or being preoccupation. If I can just mindfully detach myself from the surrounding and give my best to the patient, I think that is required by each one of us. By each one of us. Then we also, okay, I think Dr. Sheetal, you have picked up a good point, and I want to talk about it. We feel our empathy will come in the way of our clinical judgment. I think you are right on dot. A lot of us think empathy means being emotionally attached to the patient or getting emotionally involved with the patient. Absolutely not. Empathy rather detaches you from the patient. You feel empowered because it's a cognitive process. It is sympathy that will attach you with the patient. It is sympathy when you carry that patient's problems with you home and you talk about those problems and you feel pity on the patient. So empathy does not require attaching yourself. And a lot of us have a confusion between empathy and sympathy. Yes, Dr. Deepak, I completely agree. Media bashing, we get frustrated with this situation, and as a result we become immune to or aggressive or indifferent to people or insensitive to people. I agree with you. Role models are missing. Again, I agree with you because we don't have good role models who would express empathy. Absolutely. Dr. Puneet, I'll be showing you a slide, a beautiful slide to differentiate between empathy and sympathy. Give me a second. I think Dr. Mohan wants to say something. Please go ahead, Dr. Mohan. Yeah.
My fear has most often been how much empathy to show, because each client that comes to me is different. Their expectations are different. I have often found that showing empathy, I become the victim finally.
So that means we are not clear about what empathy is. We are
how much
mingling.
empathy? Yes.
I'll give you an example. In healthcare, we experience 4 kinds of emotions. A patient comes in and I am on duty. The patient has come to the emergency department. It's a government setup. I'm busy doing something. I make the patient wait. I say, "Baith jaiye, abhi dekhte hain," and I keep doing what I'm doing. It's almost like 5 minutes. Patient is in pain, has come back, come with a lot of pain and suffering. His attendance is also very, very, this thing. He comes to me and he says, "Ki ma'am, itni der ho gayi, please dekh lijiye." मैं कहती हूँ 5 मिनट वेट करो, अभी टाइम लगेगा. This is apathy. When I'm not able to see the patient suffering, this is apathy. Now he comes in a very aggressive way. He's angry. He's very upset with me and he's rude with me. He says, हॉस्पिटल में फिर क्यों बैठे हैं आप लोग अगर पेशेंट को अटेंड नहीं करना, आप अपना काम ही कर रही है तो फिर क्या, फिर हमारे यहाँ आने का क्या फायदा है, हॉस्पिटल में आने का क्या फायदा है. That's very insulting to me. I'm really unhappy with the way he has behaved with me. In the heart of my heart say, आपको अभी और 5 मिनट वेट कराऊंगी. I have to teach you a lesson to behave with the healthcare provider. This is antipathy. The third emotion is a lady comes with the child. She's crying because the child is really, really unwell and she's crying. Seeing her cry, even I start crying. That is sympathy. Empathy is when somebody is really, coming with suffering or pain, and the attendant sometimes even act aggressive. If I can see that aggression is coming because the patient is concerned about or the family is concerned about the patient's welfare, I attend to the patient and tell the family that I'll talk to you later, let me attend to the patient first. And proactively I handle the patient. That is empathy. In healthcare, what we require is empathy. Very quickly we become, antipathic because we get annoyed with the way they behave with us. We become insensitive, rude, reactive. And sometimes we, like you said, I become the victim. When you become the victim, that means you are attaching yourself with the patient. So in patient care, we don't require sympathy, antipathy, or apathy. What we require is empathy. Let's have a deeper understanding of what exactly the empathy is. Let me show you a slide that will help you see. Okay. So empathy is non-spontaneous. Sympathy is spontaneous. The moment we see any movie that in which the hero is dying or something of that sort is happening, we start crying because it doesn't require any effort. It is a spontaneous. It's an emotional way to reacting to a situation. Empathy is intellectual. You will never lose sight of the patient welfare. You will never lose sight of your capability to handle this situation. So it's an intellectual process. It is advanced and effortful, whereas sympathy is primitive and it is effortless. Empathy is appraisal, sympathy is arousal. Empathy is understanding, sympathy is more to do with feelings. Similarly, empathy is a cognitive behavior, sympathy is an affective behavior. Empathy creates separateness. In sympathy, we become closer to the person. That's what I said, being friendly and being friends. You are being friendly, but you are not being friends. There's a clear demarcation between the two people. Then empathy is a learned behavior. Sympathy is innate and genetical. It's a neocortex, that's limbic system. Empathy is parasympathetic, sympathy is sympathetic. Empathy is inhibitory, sympathy is excitatory because it involves emotions. Empathy is actually energy saving. Sympathy is energy consuming because you are getting emotionally involved. So this can even, when you go home, you will be carrying patient's suffering and burden with you. Whereas in empathy, you will do your best, whatever you can do to save the patient, to help the patient to reduce the suffering. And that will be the end. So you will not carry any anger, sadness, unhappiness with you. So professional burnout is less likely in empathy. Whereas in sympathy, as you are carrying emotions with you, you're going to carry the burden of emotions, and that's going to lead to burnout. So I really need to understand this situation, Mr. Mohan. Like you said, that you become victim of this situation. There is a possibility there's an emotional trap and that you get trapped into. So we have to be careful that we do not become fool in that situation. There is a possibility.
What I meant by saying become a victim is that the client takes us for granted. That way, not that I carry home the problem. I can compartmentalize my professional life and my domestic life. But the client, over a course of period, takes us for granted. This is my fear.
So wherever the line between the patient, the client and us actually, becomes diffused, there's a possibility the patient might jump across the line. So that line has to be very clear, and we have to follow the rules of the game so that the person knows I cannot cross this line. Yeah. So, and we'll be talking about it more when we'll talk about assertion as a way to, handle your professional relationship. We'll be talking about it. Okay. So 6 ways to practice empathy, at least in healthcare, that I can say. When the person is saying something, listen attentively. Listening is therapeutic. A lot of time you cannot do anything. For example, if the patient is in the 4th stage of cancer, probably you cannot reverse the situation. But if you're able to listen to their whatever they're talking about, even that acts as a therapy to them. Withhold judgment, because we are very quick to have judgment. The mental judgments are formed very, very quickly. Be understanding, that means look at things from the patient's perspective, from their point of view. Through your body language, show empathy, because as I said, 55% of the communication is your body language. Then practice mindfulness. So whatever you speak or do or say, that has to be done very, very carefully. And in case if you have something to ask an open-ended question rather than giving a statement. And I think if we start practicing it slowly, we become more pro at using this in the way. So I think disease and death, it's very scary. You get to see its impact when you are actually personally affected by it. Although I don't wish anything of this sort for anybody, but I think once we have experienced something like this, we become more humane. We become more kind and compassionate to people. I have a video to show, but I think I'll show that video maybe today at the end of the session, or maybe anytime in between, because it will take at least 5 minutes and it's already an hour. Or should I show you the video? I think I'll finish up with the video that's related to the topic empathy. So maybe you will give me a second. So this video, I think maybe many of you may have seen this video. It's on empathy by Cleveland Clinic. And it's available on YouTube, but it's a wonderful video to talk about empathy. I'm sure some of you may have seen this earlier. But I think every time we see, we get a same kind of feeling that there's a lot of suffering around us and we really need to be more human with our patients. Yes, Dr. Puneet, I completely agree with you. It's a beautiful video. It's by Cleveland Clinic, Ohio, and I think very, very, extensively used in healthcare to talk about empathy. It really expresses the feelings very well. So, any questions about what we have discussed about communication and developing competencies? Any question or any feedback before we move to the next topic? Yes, sir. Go ahead, please.
I have one question. How to control the development of sympathy with the patient? Sometimes you have a difficult patient. Sometimes you may have complication after the surgery and the patient is suffering because of that. Sometimes, I mean, at those situations, how to deal with this, the development of different emotion?
So if I may ask you, how do you know it is sympathy and not empathy?
How do you
know that it is sympathy and not empathy? Because if the patient is in pain or suffering or some surgical complication, although known case, maybe poor prognosis, you knew that the patient will not be able to get vision or will not get a good result. So feeling for the patient is perfectly all right. Only thing is, if I'm getting affected in terms of my performance or my lifestyle or my personal life, then it is sympathy.
Sometimes the previous day complication affects your surgery next day.
So that means I have not closed that. So I need to sit and reflect. So
how to set your emotimeter to zero next?
So I think we need to sit and reflect on that case and come to a conclusion where we close the case with clarity. What is the way forward? For example, if there's a learning to be done, I would do that. If I need to refer that patient, I would refer that. Whatever corrective, CAPA and preventing, CAPA we talk, corrective action and preventive action, I need to take from that case. And then I create peace with it by taking appropriate action. For example, if that patient requires referral, or if that patient requires counseling, or if that patient requires follow-up, or second surgery, or counsel, or education. So whatever has to be done, if you're taking steps one by one, that means you are doing your responsibility carefully. Then automatically you will feel satisfied and happy. See, complication is not in your hand. But how you handle that is completely in your hand. A lot of time we try to close our eyes to that. Or we try to put the blame on others by not taking the responsibility. Most important is to see where have I gone wrong, what could have I done, so that in future cases I take that preventive and corrective action. And whatever best you can do in the patient's interest. If that patient requires follow-up at another center, without bringing my ego or my self-respect or my reputation in, I refer the patient and tell the other person that I have had this complication at my setup and I know you are the best person to handle this case. Can I refer my case to you? That will be the highest level of empathy, where your ego does not come in the way of patient's interest. So sitting with yourself, working on every case, wherever we are human beings, we would go wrong. There can be errors at our end. But how do I handle those errors so that I minimize these errors? So getting emotionally disturbed is completely all right. You're a human being. You will be upset with your performance. You will be upset with what happened. Even if you didn't, you didn't do it intentionally, but it can happen. And we know retinal detachment, vitreous loss, these are all very common things that will happen in your surgery. But did I give my best? Did I try my best? Did I learn the best way? And when I did it, what was the gut feeling I had? Did I take a corrective action, preventive action to prevent that error from happening? Then your conscience is clear. So it's a journey, I think. I would say there's no one-line answer to it. But it's important is the first step on this journey. Every day you will evolve. Every day you will feel yourself better. So there are 4 stages. First is, I think we talked about it last time also, unconscious incompetence. I didn't know that I didn't know how to do it. That is the first stage. I didn't know there are so many other ways to do it. That is unconscious incompetence. The second stage of learning is conscious competence, probably the most difficult, where we get to accept that, okay, I didn't know how to do this. I didn't know how to deal with this. The third stage is conscious competence, where you will put in efforts to change the way you are working or functioning or operating or thinking. Again, it requires a lot of effort. And the final stage is unconscious competence, when this will become part of your way of life. We all make mistakes, but what do we learn from them and how do we move forward? And we'll be talking a lot about how do we handle difficult situations and resolving complaints, addressing their concerns. These are all topics we are going to discuss in session 5 onwards. Yeah. Any other question about whatever we have discussed till now?
We repeat the 6th way to practice empathy.
Sorry?
You explain the 6th way to practice empathy.
So see, the first was to do you want me to show that slide once again?
Yes, ma'am.
Give me 1 second. Actually, I will be sharing the YouTube video with you. Okay, let me, I think you are keen to note it down. Give me 1 second, it's okay. It is, okay. That was asking open-ended question, last one, yeah. That will allow the person to narrate their part of story.
Thanks.
Ma'am.
Please go ahead.
Yeah. Right. So there's a question I wanted to ask. Supposing, like, yes, there, like you said, there is a situation where there is a complication that has happened, and a colleague has been in that zone for a very long time. It so happens that something has happened and the colleague is really, really disturbed. He's doing his best, you can make out, he feels bad about it and everything. So these things all happen very often. Now the question is, how you sort of bring out that this complication has occurred, what you say, what you don't say. I think how exactly that communication should happen in it needs to be scientific, it needs to be in their own language, how it should be, these sort of things sort of whom you should be speaking to. In our social fabric, basically, we have not only the patient, the spouse, the family, so, and how often you speak. So there are these situations that we handle quite a lot of times. Like the doctor would probably talk to the same set of relatives or maybe different relatives at the same time, and that kind of, I think that's a lot of emotional fatigue as well. So how best, I know there is no correct answer, but how best can one sort of handle this?
Although all these things we are going to talk at length in the future sessions, but I think it's important to answer your question here. See, I think what I would say, it's very simple. I'll make it very, very simple for you to get the answer to what you're looking for. First of all, very important is to build right rapport with the patient. Build connection with the patient, because winning patient's trust is very important. If patient has trust in you, the chances of argument and disagreement would automatically get reduced. That is one thing. Second thing is, please identify the primary caretakers of the patient. Especially if I talk about the Indian healthcare delivery system, we will always have 1 or 2 or 3 people who will be the primary caretakers of the patient. It's always a wonderful idea to know them, create familiarity, and create good rapport with them. And how do you create rapport with them? Whenever they come with their concerns and questions, and which are very pertinent ones, they need to be addressed. Should we get the treatment done? Is this the only way of treating it? Can we take the patient somewhere? Can we go for second opinion? Do we have some alternative treatment? We need to answer these questions. Time has gone when patient never came with these questions to us because they just trusted us blindly. Today, they have access to Google. They are meeting so many people around, so they get a lot of questions and information from people around them. And they're paying for this service. They are going to come and ask you, put yourself in that position. If my child or if my family member had a problem, will I not go for second opinion? It's perfectly all right. So that means talking to them, answering their questions in a satisfactory manner is my responsibility and it's part of my duty. I can't say I will not do that talking. That would really help you. Now coming to, there are a lot of relatives who are coming to you that can be handled very well if you connect with the primary caretakers, and at the end if you say, see, I have explained you everything. Now if your relatives want to know about you, I think you can talk to them. Plus, regularly updating the family is very, very, very important and beneficial to us. If you have a patient admitted, just 1 second, there are 2 people in the waiting room. Okay, so if there are, if a patient is admitted and the family is paying and they are waiting outside almost like 24/7, at least those 10 minutes in the morning and 10 minutes in the evening talking to the families are responsibility. Letting them know what is being done inside, what is the condition, what is the prognosis, what is the possibility, what is the plan of action. I mean, I hear this from people, consultant would visit the room, and especially patients who are admitted in nursing home. Kaise hai? Theek hai, khana khaya, koi dikkat to nahi. That's not they're asking. Ask what are your concerns. Do you have any questions? Do you want to understand something? So that is the way we need to satisfy them, and then keep them updated about whatever the condition and the prognosis is. If they're paid lakhs of rupees and one day I come and tell them, sorry, the patient is no more, they're going to catch hold of my collar. Every day they should know what is the status, what is the possibility. And if they say that we are worried about finances, I have to understand their concern. I don't think anybody has kept any 10 lakh or 20 lakh rupees in their bank separately for medical aid. Has anybody kept, any one of you? Usually not. So that means we have to understand they are paying through nose. So we are accountable. And if you have prepared them, even if prognosis is poor, put the ball in their court and ask them. I mean, the chances are very less, but considering the age or whatever the good factor are, we can still take a chance. But I ask you to take a decision. Do not take decision on the patient and the family's behalf. Provide all possible information and let them take a call. They will 100% come back to you. डॉक्टर साहब जो भी कर सकते हैं करिए, पर ये उनके मुंह से सुनना है. हम ही बोल देते हैं नहीं एडमिट करो, अच्छा हो जाएगा, उम्मीद है ठीक हो जाएगा, तो उन्हें लगता है कि हम ग्रीड से कर रहे हैं. Then we become, we are on defense. But give them all information in a very factual manner. So there, I think, being humane, being understanding. So when they say about money, देखो भी पैसे का तो आपको देखना पड़ेगा, वो मुझे नहीं पता. I can't say this. Instead, I can say, देखिए, I can understand money is an issue, and I know it's difficult. But then you have to take a call. How do you want to look after him? So that means I have to give a very balanced kind of conduct a dialogue so that they can comfortably ask me what they want to ask, and I should be able to handle those questions. It's only a matter of practice. We are not used to talking, but we have to become comfortable with the idea of handling these questions, especially when they talk about money, prognosis, we are not comfortable. Say honestly, this surgery has a risk, but do we have any other option? I wish we had any other option. I would have recommended, but I think this is the only way we can take a chance to save the patient. So again, what you're doing, you are telling them that had I been in your place, I would have kind of decided on the same lines. So if you have been able to do all this homework, I think when it comes to even announcing something like death, they will trust that you haven't done, you have done your best to save the patient. It was inevitable. And you will see, if you have been able to build wonderful rapport, at the end, even then, I mean, they'll come back to you and they'll say, Doctor Sahab, aapki taraf se koi kami nahi thi. You did your best. But that dialogue has to be earned now. It will not come automatically. We have to make all our efforts to get this from the patient. I remember I was taking a session at AIMS Rishikesh. Dr. KPS Malik is there right now. I think he's as a consultant. So he shared his experience. He said a lot of time patients would lose their eyesight in surgery. They will still come back and say, Doctor Sahab, aapki taraf se meri aankh bachane mein koi kami nahi thi. I don't know, like this is what he said from his experience. So this is something we have to really, really learn from the patient. And that's the need of the hour now. Any other question or statement or anything that you wish to?
I have a little different opinion here.
Please go ahead. Yeah.
I'm into the hospital administration for the last 16 years and running a very critical hospital here in Delhi.
Yeah.
In this, the pandemic COVID era, we had good amount of deaths with us, and the doctors have really worked well. We did elective intubations for the patients. We extubated also the number of patients. But this era has shown a very different sort of an attitude from the patient side. In my personal hospital, when there was oxygen, deficiency, there was a lot of oxygen death in Delhi. We were being crowded by 80 to 100 people, and especially my office was broken. Even my lady doctors were, rescued from the hospital premises. They were sent to the terrace, but somehow, we managed. Yes, I agree with you that we have to be, sympathetic. We have to have empathy for the patients. But I don't think, ma'am, it is vice versa nowadays. The patient has become so arrogant that even if we are performing heroic things, not, seeing our life, our family lives. Yes, I lost number of my friends in this pandemic. I lost an eminent urologist with me. I lost a general physician. We lost a very good, a remarkable, joint replacement surgeon of St. Parmanand Hospital, Dr. Shekhar Agarwal. But, ma'am, I'm sorry, I don't know my colleagues will agree with me or whether you will agree. Patient has become thankless. They really don't understand, the constraints of the medical fraternity. They are not ready to understand what pressure we are going through it, And, at the end of the day, if something goes wrong, even if you have a repo, the patients have turned to be violent, Yes, in this pandemic, we lost a lady of 29 years old. She was Shivani Goyal. We did a, elective intubation for her because she had all, bad CT with a high scoring. And, the relatives of that patient, they created such nuisance, in the hospital for more than 8 to 10 hours that we had to take a police backup. So I don't know, ma'am, I'm right or wrong, but
Dr. Chitwal, I completely understand your feelings, and I know a lot of us have seen something like this in our setup. I don't deny that. I would say 2-3 things, and I would not discuss on this further because then we will be deviating from the topic of discussion. And it is out of the preview of this program because we are doing a master trainer program on healthcare communication, and such experiences, of course, they are the real life situation. One pandemic situation is one of the rare kind of a situation we all are facing. So it's a very, very, normal reaction to an abnormal situation by all of us, including people and healthcare professionals and everybody. That's one thing. Second thing is, see, like patients generalize that all healthcare facilities and all doctors are so, and so, blah, blah, blah. We are also generalizing that all patients are like this. I'm sure these patients who misbehaved or created ruckus or damaged the hospital, I don't deny that they are right from the society and they are from the patient party. But at the same time, there are many patients who are very thankful and very nice and very, okay with everything. But I understand, I mean, one case is enough to destroy your belief in your humanity and your empathy and your, compassion for them. Similarly, as if something goes wrong with them, they kind of generalize that all doctors and all healthcare facilities are cheat and they are there to make money. I completely understand, but then we'll be digressing from the topic if we get into discussion. I'm sure some people will agree with you, some people will agree with me, and of course, even I'm agreeing with you. I'm not against to what you're saying. But then in general, what works? I'm talking about that. Wherever there's a risk of mob attack, yes, whatever stern action needs to be taken for your safety, for your staff safety, for your hospital safety, that should be taken. What I'm talking about, what can prevent it? There is a possibility we do a lot of things for the patient, but we do not communicate with the family. We don't counsel them, we don't prepare them, we don't let them know the chances of survival are very, very low. If we were able to make those communications, probably the number of cases of violence and aggressive reaction can be reduced because they will be prepared for it. That's what is my understanding. If somebody knows that this can happen, then they're more prepared for it. So I can't comment on that because I don't know what preparation actually went or not went into this case, but I really feel sorry for if something like this has happened in your hospital or in any hospital. And I completely understand that we have had such cases, across. I completely understand you. Can we end that point here, Dr. Chetwal? Is that okay?
Yes, ma'am.
Thank you so much. Thank you so much. So moving further, because we have another one topic to be covered. This next topic is how do you go about designing a training program? Although I know, looking at the group that I have, I don't think any one of you is actually going to be a trainer per se. So this session, some of you may find that I'm not going to design a training program, so why the hell should I learn about it? But the idea is, even if your staff under you is going to design a program, if you know the methodology, if you know the steps, at least you will make sure that the training goes well, actually has its impact, desired, outcome that you want to have. Plus, I think a lot of you must be speaking in conferences or in some meetings and, your CMEs and at different places. These tips will help you even make your presence and your presentations impactful even in those conferences. So attend the program with very, that kind of interest, that there are tips that will help you in delivering your sessions more effectively, interesting manner. And plus those who are in training or under whom the trainings are being done, definitely you will be able to make sure that the trainings are, done successfully, meaningfully, purposefully, and they have their desired result. So if I may ask you, what are the usual challenges that you experience in designing and executing a successful training program? If you may write in the chat box. Content creation. Okay, I agree. Mr. Mohan, yes. Understanding the audience. Absolutely. Yes, I agree with you, Mr. Vijay Kumar. Okay, connect with the audience. Absolutely. Yes. My staff complains they don't have time. Yes. So that means they think that it's a time waste or not required. Absolutely. Finances can be a problem. Okay. Training need analysis not done. Absolutely. I agree with you, Dr. Deepak Singla. Then counseling the audience. Counseling, exactly you meant, how do you prepare them, Dr. Chetwal? Is that you're saying? How do you really prepare the audience for the session?
Yes, ma'am. How do you exactly prepare the audience?
Audience, yeah, wonderful. So I completely agree. I think we all are doing training programs because that's the way that now we are trying to, bring change in behavior and attitude and, in their overall working. I think some more answers I can see. Right target audience. So who is your right target? Selling them the important. Absolutely. So these are the common challenges we all are experiencing. And this session will help you to see how you can make sure that you are able to not only create interest, create value for your program, and engage your audience and make them participate, and see that you are able to, give the result that the program is desired to do so. So there are some more answers. Let me quickly take them. Okay, gap between my work and my world and their world. Yes, that's another this thing. Then actual need versus misunderstood delivery or offering. Yeah, a lot of time we don't know the actual need and we deliver something that's not the required input required. Absolutely. So I think this whole program has been designed with the idea to help you with the content. One, I have already shared the content with you right before the program. And second is the delivery part. How do you really engage? How do you really create interest? How do you help them see the value of your program and how that's going to benefit them? So all that is going to be covered in this session and in the coming session. And also you will get an idea about how do you really engage your audience. So if you see yourself today and the day one when you came in, I can see a lot of change in all of yours participation. The interest, the answers that you're giving, the way you are reciprocating, that means you are realizing, okay, there is something interesting and useful that we are going to get through this program. So that's what we are exactly going to discuss in today's program. So let me quickly share the screen with you and show you a couple of slides so that we are on the track. Okay. Okay, so I'm going to talk about how do you go about designing a successful training program. I think first and foremost thing is the clarity between who is your client. A lot of time we think, if I am a trainer, for example, so I think my client is the person who is inviting me to do a program for them. Whereas your client is not only the person who is organizing the training, but it is the participant also. So I have to target both the organizers and the participant, and both of them are my clients. Second is about their usual expectations. What are their usual expectations when somebody is, organizing a training program? So what do you think are their usual expectations from you? That you will do some miracle, that you will bring some change. Suddenly there will be a behavior change. So a lot of time when I started doing my programs, I had to talk to myself and ask, what is your expected outcome? So a lot of time we think some magic. Exactly, Dr. Achita, I agree with you. People expect magic from a training program. So I must remind you that these programs can bring a change in their attitude, can lay a foundation for behavior modification, because behavior modification is not easy. It's a very slow process and it takes time. But it puts your participants on the way to self-reflection and self-correction. So these sessions can be taken as for creating awareness and sensitizing your audience to the importance and relevance of effective communication. Of course, once there is a knowledge base, like for example, if I talk about that stages of learning from unconscious incompetence to conscious competence. So there they will try to now start applying the skills that they will learn through your training program. The first step when you are going to organize a program is to find the training needs. Always design your program based on the training needs. So if I may ask you, how do you assess the training needs? What different ways do you use to assess the training needs? If you may write in the chat box. So how do you decide that, or how do you find out that what are the training needs? Okay, performance appraisal, circulate a questionnaire, absolutely right. Okay, when you see poor interaction, checklist or Google form to identify training needs. Okay, feedback from patients and peer. Okay, By observing incompetence, absolutely. Get the requirement from participant, assess their level of knowledge on the topic, absolutely. So you get an idea how much they really know. So there are many ways to do training need assessment. Of course, there are templates available to do training need assessment. You can actually do formal training assessment. But if you will do interview, knowledge assessment, skill assessment, on-site observation, mystery customers, or ask the management, what challenges are you facing? Even the feedback from the patients will give you an idea about the need for, the specific need, training need. Complaints, suggestions that you receive from patients and from public, that gives you a good idea about what the training need must be. But if you can formally do a training assessment, there's nothing wrong in it because you'll get a very exact information. Now, develop your program based on the training needs and expectations of the organizers. So like one of you answered, we need to really know what is required rather than what we want to give. What is the need? That is something we really need to assess. Step 2 will be develop training objectives. Now, based on the training needs and expectations of the organizers, develop the training objectives. So what are you going to achieve? If you have clarity about the objective, it's something like you know what you want to achieve. Then would be how you want to achieve. So very clearly, we need to know what are my training objectives. I want my participants to know about this. I want to bring change in their attitude on these areas. I want to skill build on these. So you really need to have very clearly spelled out the training objectives. It could be 1, 2, 3, whatever, but then it has to be, well defined before you do the training program. Step 3 will be create your bucket list of points. Now, you see, some of you are seasoned in your field. So the moment you will think of doing a training program, you will actually be knowing what you want to speak. So you will actually know what I'm going to talk about in this session. You will be able to quickly note down, okay, I need to talk about behavior, I need to talk about body language, I need to talk about dressing, so you will know what you need to talk about. But a lot of us may be still thinking to do a program and may not exactly know. So at that point, I think one good idea will be do little R&D and see what others are talking about. So maybe if you Google search, you'll find a lot of reading material around the topic that you want to. For example, if it's about professional etiquettes, so immediately maybe you will have some idea, but if you will have a look at some of the presentations available on Google or some content available, you will get an idea about that. So what I do when I do create a bucket list of points, I normally use this tool called eDraw Mind Master. If you want, you can note down. Both the versions are available, paid and free. I use free because that works for me. And I think if you go for, you can download it on your laptop. It's a very good tool I use very often whenever I start thinking about a program or a session. I'll just show you one sample so that you have an idea about what I'm saying. Give me a second. Yeah. Okay. So are you able to see this is eDraw Master. I'll just close this so that I can also see. So for example, this is one topic I was supposed to talk about. So what I would do, whatever ideas that came to my mind, I would just, it is more like a whiteboard for you. So you will keep the title here, and then whatever ideas come to your mind that you will keep noting them down. So I can even have a floating topic that I don't know where I want to write. I maybe write something here and then I leave it here. And then later on, if I think this is something useful, I can bring it here and attach it here. So what exactly I mean by, eDraw Master, this gives you an opportunity to note down everything that comes to your mind when you are critically thinking about your topic. So as a result, you will not miss on anything. So I very often use this as a tool to plan for my session. Even like for your conferences, for your presentations, for your program, you can use this tool to prepare for your presentation. Now, once you have created the list of points that you want to talk about, you will have to create a flow in the content. So something will go in the beginning, something will become part of the body, Something will fit well in the end. And then of course the takeaway. So all those points that I have written on eDraw Master, then I would bring and put them in order so that I know how I'm going to start, what is going to be delivered in between, and then what is going to be the part of the end of the program. So after I have created the flow in the content, it's very important. I think the most important part comes here is how do you develop your training pedagogy. So if I may ask you to write in the chat box, what are the different training pedagogies you are using right now? As of now, what are the different pedagogies you are using right now? Yeah, Dr. Himanshu, you're right. That's mind map. Exactly. Something like mind map. Yeah. So lectures, role play. Okay. That's a very good to see. Slides. Absolutely. Very often we use PowerPoint presentations. Absolutely. Simulated scenarios, PPTs, role play, slides, quiz, skits. Okay. Very nice. Debriefing. Yes. So we are all using different ways of, delivering, and that's actually very much required, because now you really need to be ready with what is possible to engage your audience. So simple PPT, simple lecturing, if we are using that way, it's really out of now, the way of engaging your audience, especially the kind of online sessions, where you really need to have your audience attention, you really need to engage them. So a lot of puzzles, questionnaires, poll, all these are being used. Storytelling, rapid fire round, these are extensively being used in training program. So I'm sure you will have a bucket full of these training pedagogies, exercises around it, so that you know what to fit where. So the same pedagogies you will now have to integrate to create interest and engage your audience and engage it with the flow of your content. So very important is to have a list of this pedagogy. So after the next session, after the 4th session, from 5th session onwards, each one of you will be making 10 minutes presentation on one of the pedagogies. I'll be sharing a list of pedagogies. You will have to choose that pedagogy, and then we will be interacting one-on-one, that how exactly you have to deliver 10 minutes presentation, or what exactly you have to deliver, and you will be making those presentations. So like we will have around 18 presentations or 19 presentations. So 19 new ways of doing, delivering or speaking in a conference or a presentation. So that will be a very rich learning for all of us. So integrating these, step 6 is now you have the content ready. So you think, okay, I want to start with the puzzle, or I want to start with the video, or I want to start with the storytelling. So in between, where you think this point I want to, focus on, but just talking will not do. So maybe a puzzle around it, or maybe a role play around it will really, really help. So that's how you have to, now complete the structure of your presentation. Of course, as a step 7, you will have to develop some course material. It could be a handout, or it could be a handbook, or something that the audience will take with them, so that they can, revisit or read it. Another very important step is to develop questionnaire for pre-test, post-test, and feedback. I think all 3 are important. Pre-test will get you an idea where your audience is. Post-test will give you an idea how much have you been able to really, bring change in their knowledge or understanding or attitude. And then of course, feedback is a wonderful way to know if you are on track or not. So develop these questionnaires, be ready with it. I have shared a set of these things at the back of the content, towards the end of the content, if you had a chance to look. If you look, I've given a couple of samples of, pre-test, post-test, and feedback form. Execute your training. So execution part we are going to cover in the next session, and that will be under facilitation skills, where we are going to talk about how exactly you should be facilitating a training program. We will discuss this at length in our next session. After you have executed your training, very important is to take feedback from your participant. So preferably it should be as simple, direct, and anonymous, so that people can comfortably, honestly give their feedback. Step 10 is to sit and reflect on your training. I think that's most important step that we must do. Each one of us would have a gut feeling after we have done the training. If you sit with yourself, revisit your training, think about what all happened in the training, what were your high points, what were your low points, what you need to change in terms of your, delivery or maybe content or presentation or speed. It will give you a fair idea about how you really need to, improve your way of working. So these are the 10 steps that I would, suggest. So can we quickly summarize what exactly are the steps if you can write in the chat box? If each one of us can write one step at least to designing a program, I'll go further about some of the important points after this. Training need assessment, absolutely. Identify training needs. What else? Objectives, yes, training objectives. One must have training objective. Content, be ready with the content, okay. Design the content. Bucket list of points, absolutely, bucket list. So that word has stuck with a lot of you, very good. So develop the training objectives, create a flow of content, bucket list, absolutely. Mind map, yes. Mind master, draw mind master also, you can remember, that's also a good tool which will help you. Create flow, draw, yes. Decide your pedagogy, customize your pedagogy, absolutely. And then feedback, pre-test, post-test, content, handouts, and then finally the evaluation, reflection. So I think we have covered almost all the points. Now, some of the things that we need to consider in each session when you're designing each session, I think first important thing is, who is your audience? Is it helpful to know the details of your audience? Yes, it's helpful. Absolutely, it's helpful. Okay, how will this help? If somebody can unmute and say, maybe one of you can, unmute and say, how is it helpful to know about your audience?
I think it's
depending on the audience, we can customize our content and at the top.
Absolutely.
Yeah.
Absolutely. It's very important to know who is your audience, because a lot of time you will prepare for a general set of audience, but the audience may be very different. So for example, if it is for doctors, the content and delivery will be different. Methodology also will be different. If it's for front desk staff, it will be different. For nursing staff, it will be different. Even among doctors, for resident and for consultant, your audience, your delivery is going to be different. So it's very helpful to know who is your audience. So usually when I do a program, I would always make an Excel sheet and send the Excel sheet to the organizers and tell them, please share the details of the audience. I even go to the extent of not only knowing the name, qualification, experience, but also ask their experience in training and also what are their learning objectives, so that you have some idea what they are looking forward to. So it's very helpful to know who is your audience. Second thing is about audience size. It's very important to know what is your audience size. A lot of time, your audience size may be such where you cannot do some set of pedagogies you cannot use. For example, if it's a large size group, and if you ask them to start giving their introduction, like if you remember in the first session, what happened? For all these batches, I was doing introduction part, which got covered in 30 minutes. But for our first session, we took more than an hour to cover the introduction. So I would call that I should have been mindful of that, and I should have either given a very clear instruction in the beginning that let's keep our introduction very short, because we will get a chance to interact with each other once the program begins. But to start with, I think let's be very clear and specific about the introduction. So it's important to know the audience size. So certain activities cannot be done with a larger group. So if you remember the last time activity that we did about the word, do words have power? I did not ask everybody to participate in that organization of camp. I just asked 5 volunteers. So that saved me time, and I could do the activity with all of you. So it's good to know the audience size. A lot of time you will have a challenge where you will prepare for a smaller audience size, and it will be a very big audience size you will have to beat. It can be vice versa. In conferences, I lot of time observe, you will get an invitation to speak in an audience, and you will actually do leave your work and take a day off and leave your other work, and you get to see there's nobody in the conference hall, or there are hardly anybody who's attending there to attend you. So I mean, this is one factor which actually affects your performance also. I think another important point, which I think is a pain for everyone, how willing is the audience? A lot of us, I think, experience challenge on this front about how willing is the audience. So if anybody, just one, I mean, I can't allow everybody, but one person can share their experience about I mean, if you have experienced something like this where your audience is not willing, and if anybody did something to create interest, anybody who is willing to share their experience. I think I can allow only one person.
I think breaking the ice is pretty important. Trying to sort of get them on one page is important. So I think it's very important to have design your program such a way that people participate. Supposing you have a scenario and you're getting people to get come in, or like you said, you're creating a quiz and you say, okay, just give me your answers, and we have my Mentimeter saying how many of us answered and this like that. So I think in the beginning people come with a preconceived notion that yes, it's training and it's going to be boring. But I think when we do something like I share my own experience, or I start with a story, I think that kind of gets the audience into the foray of things. That's my experience basically.
Absolutely.
I think keeping the sessions short and effective, not going beyond maybe that 23-minute wherein the brain stops stops really concentrating. So 23 to 25 minutes, I think, of real solid content. So I think as a trainer, a lot of pre-reading or learning ourselves is pretty important. So that is
absolutely, I completely agree. So most of the times creating interest in the program will be your responsibility. I think that's another responsibility, additional responsibility trainer will have, because you will have to first generate interest. A lot of time you will not get a chance to even interact with the audience beforehand. For example, if they are your own staff, yes, you can do one-on-one talking and tell them what you're going to talk and how interesting it is going to be. But many times you will be just an external speaker. So you will actually have to make an effort to generate interest. So therefore, I think it's very important to make sure that your beginning goes very well. You're able to create that interest. And you will actually initially have to have a lot of patience also and show confidence in your work, especially if it's a program organized by the management and you are a speaker there, and people are not paying for the training. So they haven't come willingly. They have just been asked to come. Like you said, they feel that it's going to waste their time. So imagine the kind of mindset that they come with. So initially, you will have to really have patience and also create interest, do some activity of their interest, and also that conveys a message or creates interest in them. I'll be talking about it in a minute to tell how do you really create that interest in them. Okay. Again, mode of training, if it is online, it is outbound, or it is on-site training. It depends. If it is an online training, then your resources will be very limited. Then you'll have to really come up with interesting, engaging activities where your participants participate and stay engaged. If it is outbound, then again probably they have gone with a mindset of fun and relaxation. So you will have to really be careful in choosing topics and delivering your program in the shortest possible manner, and doing it in a more play way method. On-site training, you will have resources accordingly. You will have to design and plan your program. So everything have to be even the mode of training has to be kept in mind. Another important point is how much is the time available or allotted time. I remember I used to be initially invited for conferences where I used to be asked to speak for 8 minutes or 10 minutes. So delivering a talk in 8 minutes or 10 minutes appeared impossible to me. But then I realized if that's the way the conferences are run, it will be run like this. So I have to really learn the way of doing it. So I remember I had gone for a panel discussion where 5 of us were panelists, and we were given 1 hour. That means each one of us will speak for 10 minutes, and last 10 minutes were kept for discussion. So I was probably number 2 or number 3 in the list. Since I had understood that whatever time you're allotted, you have to finish in that time, I had done my practice and preparation accordingly. But a lot of other panelists could not even complete the introduction part, and they were not allowed to complete their presentation. So we have to actually learn to make sure that whatever the allotted time is, if it is 5 minutes, or it could be even 5 hours. So accordingly, we have to really customize our session. Again, resources available. For example, if it's an on-site program, so there it's very important to make sure that you have resources like proper sitting arrangement, light, ventilation, wall clock facing you, not the participant, so that you can regulate your content to fit in the time that's available. Having name tags for the participant is very helpful, because then it becomes easy to identify who is interacting with you. And even when you call your participants by their first name or by their second name, it builds connection and they also engage well with you. So these are all small resources, but they are very helpful. Of course, water and tea and other things usually are available, but these are small things. Sitting arrangement. It's always advisable to have a sitting arrangement around a table. Rather than having a lecture hall kind of a thing, it's always a good idea to have a square or a round table where 4 or 5 of the participants can sit around the table, and you can engage them by giving them group activity or interacting with each table one by one. Some tips that will help you in making your program successful. One is, like I said, create interest. Very important is to integrate what is in it for me. Please remember, first thing that you have to be able to show to your audience, how are they going to be benefited by investing their time. So if you say patients want this, public want this, management wants this, no. How are you going to be benefited? And it is always not the monetary gain. You can't pay 500 rupees each participant for attending the program. But if you remember that Maslow's theory of motivation, if you can talk about their safety, if you can talk about their respect, if you can talk about their image in the eyes of patient, if you can talk about the satisfaction they will derive, automatically they will become engaged in understanding how are they going to be benefited. So it's very important to integrate what is it right in the beginning. I think right in the introduction part, how are they going to be benefited in attending and participating is something that we have to integrate. Second thing is, beginning and end should be very engaging and very well thought. Like we all say, well begun is half done. So if you have been able to build rapport with your audience, win their confidence right in the beginning, if you are able to engage them right in the beginning, half the job is done. Then it becomes easy to take them with you during the program. And then we also know all is well when that ends well. So the beginning, of course, the body has to be good. It doesn't mean that body can be missing, but then we have to make sure that the beginning and the end are really very engaging. And there's always a very clear carry home message for your audience. It shouldn't come as something, okay, we talk, but I don't remember what we talked. So there has to be a very clear carry home message for them. Ask thought-provoking questions rather than giving information. If you are showing PPT, if you are showing information, you are spoon feeding them. So you are not challenging their creative thinking, critical thinking. But if you ask them thought-provoking question, you are challenging their, critical thinking, creative thinking. Automatically, that's going to engage them. So when you ask them to answer in the chat box, each one of them will start thinking, okay, what should be the answer that I should be writing? So they will automatically become engaged and interested in interacting. A lot of time we focus a lot on content, but trust me, experience has a long lasting impact. So if I may ask you, do you remember any of your school time teacher? How many of you remember your school time teacher? Write in the chat box. Yes. See, most of us remember. So you will not remember exactly what they said or what they did to you, but you will remember how they made you feel. Because we all store information as experiences. Anytime I ask you think of your past, you will not remember the exact content, but you will always remember the experience. You felt good or not good. You were happy or not happy. You enjoyed or you did not enjoy. So make sure that your training program creates that experience which has a long lasting impact. Content is important, no doubt, but more than that, if you're able to put them on the trail of, deep thinking, self-reflection, I think rest is journey. Just to share with you that if you are using just reading as a way of teaching, or listening as a way of teaching, or recalling as a way of teaching, they're just using one part of the brain. But if you are actually engaging all different ways, where they're auditory, we are going to talk about it again in the next session, but just to talk about that, make sure that your training curriculum and pedagogy is really very creatively designed, where you are able to engage them. And that's visible in this scan, you can see. So when you are making opinions or when you're giving statements, make sure that you are supporting your opinion and statement with studies and reports, especially with educated audience. They would prefer to have some evidence in terms of studies and reports that's more convincing and that's more evidence-based. A very important thing that we really need to keep updating our knowledge and skill. And it's not just the subject knowledge. When you are speaking to your audience, a lot of questions will come from something that's not exactly related to the topic that you are talking. So therefore, it's always a wonderful idea to have diverse knowledge of various aspects of human interaction. Regularly time your session. Keep an eye on the watch. Be realistic in how much you can cover and how much you can deliver in the given time. Initially, we all make mistakes, but then slowly, I think we get a good control over how much of content you can deliver. A lot of time, you will have a lot of knowledge and information to give, but then it has to be according to the time available. Taking feedback is important. Equally important is reading the feedback carefully. Go through each feedback carefully and try to reflect the reason for that feedback. And then, of course, that feedback has to be used for the benefit of your future programs. Regularly reflect on your performance. I don't close my laptop till I have received feedback from my audience, and I go through every feedback and reflect on it and make sure that I improve my performance in the next program. That really, really helps me. Last but not the least, I think practice, practice, practice. The more you will practice, better you will get. I think I was going through this and I really agree with this point. How many of you know about this 10,000 hours of practice into anything makes? Mr. Vijay agrees. Do others know about it? There are studies that say 10,000 hours of investment into anything can make you a master of that subject. So if you are giving 3 hours every day, it would take you around 10 years. But if you are investing almost 8 hours into something, and when we say investing means mindfully, you are trying to work in that subject and doing your best. Around 5 years, it would take 5.5 years to become master of anything. So I think delivering a talk in conference or in any, CMEs, it's a very, we find some of the speakers very engaging. Even in those 5 minutes, they are able to, deliver a very impactful talk or a discussion. It's something that we all must know, because ultimately from that's where we network and get to know people, and people get to know us. Okay, so any questions about whatever we have discussed in the third session? How much time do we have? Yeah.
Ma'am,
Please.
as you said, if we don't have much time to understand who is our audience, so how do we prepare our content and kind of make them interact more or kind of engage them?
See, one is, like, I'll share my experience with you. I do a lot of programs for Public Health Foundation of India. So I would normally ask them initially, like when I was not asking for the Excel sheet, I would just ask them, who are they? Normally they will have doctors, they will have nurses, sometimes even lab technicians, sometimes, different healthcare professionals. So they would tell me, okay, they're doctors. So you have an idea, okay, this is the group I have to talk. And sometimes, it has happened a couple of times when they said that they are nurses, but when I went, it was not just nurses, they were nurses and administrative officers. So the examples that you had, prepared, you thought that, okay, I can bring this example to validate my point. That would actually cause, at that moment, unless you're really, really ready with it. So what I would say, that it's always good to check with the organizer who is the likely audience. If you cannot get all the details, at least basic details that who are they? Are they doctors? Are they nursing officers? Are they administrative officers? Who are they? So you know what will be their training need. And also, but from after that, I've started telling that I need to know the number of participants, and I need to know who all are coming to attend the program. And that helps you. That really, it's a matter of assertion. If you once start asking them, they will definitely give you the detail. They'll be happy to rather give you the detail. But it's a good idea to always know who's your audience.
But for an online training program, and where you don't know who are your, so in that way, is it advisable to have a Google form or any kind of a thing just to understand before the training program?
Absolutely. So, for example, for this program or for all my programs, I share a Google form to know briefly about you, to understand what's your background, what's your work experience, so that I can meet your requirements, so that I can send you satisfied. Okay, this was a good learning experience for me. It's always a good idea. I think Google form has really eased out everything. Pre-test, post-test, feedback, everything is available on Google form. So I think it's so convenient. It's so convenient. Any other question?
In the beginning of the session, if we start by using some language or some of the incidences, like because now the audience is coming from different aspects of life. So now we want to take a particular topic. So in the beginning, in the introduction, should we use some gimmicks in the way that they all come to a same page?
See, you will have to really play safe, because a lot of time with senior audience, if you try to play some gimmicks, they may not be very appreciative of it, because as it is, they'll have a doubt on your, okay, like for example, when I do program with consultant, a lot of time to start with, they will have this, what is she going to teach us? We know it all. We already are doing so much. So what is there to learn? So there you really need to play safe to first establish your rapport and trust with your audience. So once they have trust in your competency, then you can play anything on the earth, because then they would know that you are experienced and knowledgeable. But to start with, I'll say it's always better to play safe, because people are skeptical. And we have seen a lot of training programs are fun, but there is no carry home message. It should never happen. Then your audience may feel good at that moment, but later on they'll not have anything to use and practice in there. So it's always good to use a safer, technique right in the beginning. Yeah. So I think there are a couple of questions. Okay, how to introduce ourselves? Any tips? Yeah, Dr. Monga, what I used to do initially, I would normally first used to introduce myself, but then I thought that takes away little time. To save on time, now I normally have my introduction as the first slide on the presentation. So people get an idea about who the person is or what is the experience and background. But if need be, and if somebody is going to introduce you, it's always a good idea to send your short bio to the person who is going to introduce you. So for example, if I'm going to speak in Delhi Judicial Academy, so they are all judges who would be listening to me. So I would send a bio because the person who has invited me will be introducing me to the audience, would take 2-3 minutes of formal introduction. But for a program like this, where we are interacting now, nobody's going to introduce me because we are all equal on the same platform. So it's okay to have a slide. People would be able to read it, from that slide and get an idea. Any other question? Yes, Mr. Mohan, I think you want to ask something.
Yes, ma'am. Ma'am, I usually give presentations to doctors. Now, I belong to the world of the legal fraternity. Now, these doctors have majority of them, maybe even 100% sometimes, or say, let's say 95% of them, don't even know what it takes to be a litigant, what happens in the court, the course of the litigation at all. I have a series of, I have various topics that I have designed. In respect of an institution, I always begin with the initial stages of a litigation so that I can give them an introduction to this. I am sometimes always concerned because I'm always concerned. And sometimes I try to reflect on it to try and see how to make the doctors understand, because they don't even know what a legal notice means. If I tell them why it is important to receive a legal notice, to bridge this gap is a big struggle. See, those people who have been involved in a litigation will be overwhelmed at the content of the presentation, because they know that these are the pitfalls that they have encountered, and these are the things that probably could have reduced the time taken in the court. But the majority of the people, see, I tell them simple things like paginate the medical records when you go to the lawyer's office in pencil, and always retain a copy of it in your hospital, because you're not sitting in front of me always. So when I call sometimes, because the case records will contain about 400-500 pages most often, when I call them and say, please read the nurse's records, I'll be pointing out to a certain portion of the record and they will not even understand. See, this is such an important thing, but they fail to understand unless they're part of a litigation. Now, I need some tips from you as to how I can get over this issue.
Mr.
Because
Mohan,
my whole world is different. I belong to a different world altogether.
I completely understand. And I think having you on board is a pleasure. I think I'm going to ask you to speak more in the time to come, where we will be talking about how do you really handle difficult, communication. See, I think most important is to help them see how it is going to be beneficial to them to understand law. That's most important. If you can show them how it is going to be helpful to nobody can remember law. Even you will not remember all the law. If I ask you to work on any case, you will have to go through your books to see what law will work here. But I know I have an expert who will be able to do it. Similarly, if I can generate interest in my doctors and help them see that you don't need to know all the laws, but you need to know the basic things that you need to look after. So if you can simplify all the laws that are pertaining to my work in say 10 points, do this, do this, do this, do this, don't do this, don't do this, don't do this, don't do this. 5 points do and 5 don't. Good enough. What I'm trying to say, and do not, as you say, I have a lot of knowledge, but then is that one session meant for teaching everything? No, I'll say it is meant for creating interest and awareness. So keep your objectives of program very realistic. So initially when people used to say me, कुछ change तो आया नहीं, तो even I used to say कि change तो आया नहीं, एक session में क्या change आएगा? एक session में कैसे change आ जाएगा? हाँ, interest generate होगा, उनमें से कुछ लोग आपके पास में, they will get back to you, they'll talk to you, they'll show interest, they will be your champions. You will always have a pyramid of learners. There'll be few will always be following you. There'll be few who will be just waiting for you to say something. So don't focus on everything. Pick up your champions, work on them, and then others will automatically work. And simplify the content. Simplify the content. If I can't understand anything, can you teach me the way that I can understand? Mr. Chatwal, I think you have some emergency.
Thank you.
Yeah, you can leave, please. And we are about to close. I'll be sharing the feedback form. I request everyone to give feedback. Yeah.
Thank you so much, Professor.
Thank you. Yeah. So, Mr. Mohan, I have strong intention. I have also even decided the top title of the program, and that is Preventing Litigation Through Effective Communication, where I expect your sessions to talk about what we need to do in terms of documentation and verbal communication so that we can prevent litigation and violence against us. I have already thought of the topic of the workshop. So you start working on it, because that is something we have to come up next. We have to work on it. So any other question from any other participant?
Basically, what kind of questions and how many questions do we think to create a Google form, so that to create a content, basically, so that it doesn't become very huge, and whoever is giving the answers. Yeah.
Okay, to know, not more than 5 to 7, very, very important ones, relevant ones, very relevant. What you need to know about your audience, that's what you need to ask. Not everything, not everything. So if we have no more questions, should we close it? Thank you, Dr. Rajesh. Thank you. Thank you, everyone. So I'm sharing the Google form in the group. Kindly give your feedback for the program, and we meet next Wednesday, 8 o'clock. Thank you so much.
Thank you so much.
Thank you.
Thank you.